Lyme disease is a disease caused by the Borrelia bacteria. People usually get Lyme disease from the bite of a tick carrying the bacteria. Ticks that can carry the Borrelia bacteria live in most of the United States, however. Lyme disease is most common in the upper Midwest and the northeastern and mid-Atlantic states. It is also common in Europe and south-central and southeastern Canada. You are at risk of Lyme disease if you spend time in places where ticks live, such as grassy, brushy, or wooded areas. Taking safety precautions in these areas can reduce the risk of Lyme disease.
If you want to get information on other important issues related to healthy and long life, you can like the video and subscribe to the channel. Thank you for watching.
A tick bite may look like a small, itchy bump on your skin. Similar to a mosquito bite, this does not mean you have a tick-borne disease. Many people will not realize they have a tick bite. The symptoms of Lyme disease vary. They usually appear gradually, but the stages can overlap, and some people do not have the typical early-stage symptoms. Early symptoms of Lyme disease usually appear within 3 to 30 days. After a tick bite, there are limited symptoms at this stage of the disease. This is called early localized disease. A rash is a common symptom of Lyme disease, however. It does not always occur. The rash is usually a single circle that spreads slowly from the site of the tick bite. It may be prominent in the center and look like a target or a bull's eye. The rash usually feels warm to the touch but is usually not painful or itchy. Stage 1 symptoms include fever, headache, extreme tiredness, joint stiffness, muscle aches and pains, swollen lymph nodes. If left untreated, Lyme disease can get worse. Symptoms usually appear within 3 to 10 weeks after a tick bite. Stage 2 is usually more serious and widespread. This is called early disseminated disease. Stage 2 may include the symptoms of Stage 1 and these: many rashes in other parts of the body, neck pain or stiffness, muscle weakness on one or both sides of the face, immune system activity in the heart tissue that causes irregular heartbeats, pain starting in the back and buttocks and radiating to the legs, pain, numbness or weakness in the hands or feet, painful swelling of the eye or eyelid tissues, immune system activity that causes pain in the optic nerves or loss of vision. In the third stage, you may have symptoms from the earlier stages and other symptoms. This stage is called late disseminated disease. In the United States, the most common condition of this stage is arthritis of the large joints, especially the knees. The pain, swelling, or stiffness may last for a long time, or symptoms may come and go. Stage 3 symptoms usually start 2 to 12 months after the tick bite. The type of Lyme disease common in Europe can cause a skin condition called acrodermatitis chronic-atropicans. The skin on the back of the hands and tops of the feet changes color and swells. It can also appear on the elbows and knees. More serious cases can damage tissues or joints. This skin condition can appear months or years after a tick bite. Most people with Lyme disease don't remember having a tick bite, and many symptoms of Lyme disease are associated with other conditions. See your healthcare provider if you have symptoms of Lyme disease. Early detection and appropriate treatment can improve outcomes. If you know you have had a tick bite or may have been around ticks, watch for symptoms. If symptoms occur, see your healthcare provider as soon as possible. Lyme disease is caused by the bacterium Borrelia in North America. The bacteria is mainly carried by the black-legged tick, also called the deer tick. In Europe, Lyme disease is caused by a different type of Borrelia. Ticks carry the bacteria. These ticks are known by several names, such as the Indian tick, sheep tick, or deer tick. Ticks attach to the host's skin and feed on blood. The tick feeds until it swells to many times its normal size. Deer ticks can feed on the host's blood for several days. Ticks pick up bacteria from a host such as a deer or rodent. They do not get sick, but they can pass the bacteria to another host. When an infected tick feeds on a person, the bacteria can pass into the person's bloodstream. If you remove the tick within 24 hours, The bacteria are less likely to spread Lyme disease. Both young and adult ticks can carry the disease. Young ticks are small and difficult to recognize. You may not notice when a young tick bites you. Some people with Lyme disease report symptoms that persist after treatment. These long-term symptoms may include arthritis that starts with Lyme disease and does not get better, body aches and pains, constant or frequent fatigue, memory complaints. These conditions are not clearly understood. Some people with these symptoms may be diagnosed with Lyme disease syndrome or PTLDS after treatment. These problems can be caused by incomplete treatment, reinfection with Lyme disease, and immune system response to killed bacterial fragments. Immune system activity that damages healthy tissues, also called autoimmunity, and diagnosed conditions other than Lyme disease. The best way to prevent Lyme disease is to avoid tick bites. When you are outdoors, most ticks attach to your lower legs and feet when walking or working in grassy, wooded areas or overgrown fields. After a tick attaches to your body, it usually crawls upwards to find a place to enter your skin. If you are or plan to be in an area where ticks are likely to live, follow these tips to protect yourself. Spray your outdoor clothing, footwear, tent, and other camping equipment with a repellent containing 0.5% permethrin. Some equipment and clothing may have been pre-treated with permethrin. Use an insect repellent registered with the Environmental Protection Agency on all exposed skin except your face. Wear light-colored clothing that makes it easier for you or others to see ticks on your clothes. Avoid open-toed shoes or sandals. Wear long-sleeved shirts tucked into your pants. Wear long pants tucked into your socks. Shower as soon as possible to wash off loose ticks. Check for ticks that may have burrowed. Use a mirror to check your body well. Pay attention to your armpits, hair, and hairline. Also check your ears, lower back and between your legs, behind your knees and inside your belly button. Check your equipment before washing your outdoor clothes. Put them in the dryer on hot heat for at least 10 minutes to kill ticks. Lyme disease is a disease transmitted by an infected tick and can have serious consequences. This video is designed to help you learn about Lyme disease. We have provided detailed information about the symptoms, causes, and prevention. By recognizing the symptoms, you can diagnose the disease at an early stage and start treatment immediately. We have also explained the precautions you can take to avoid tick bites. When spending time in nature, it is important to raise awareness to protect your health. We hope this video has provided you with enough information about Lyme disease. Take care of yourself for a healthy and happy life.
You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.